Hello, everybody. Welcome. We're going to be getting started real soon with our presentation. We just are going to give a little bit of time for some more participants. I see you guys are still logging in. Welcome, Alma. Welcome, Ileana. Well, you were already here. Welcome, Bob. Let's see. Welcome, Christine and Jess. We have our chat box here. If you guys look at the bottom of the screen, you can click chat. And the chat box is here so you can say hello if you'd like to introduce yourself. And if you have questions during our presentation, then please put your question there. We are going to have a question and answer session at the end. So I'll keep track of those questions and we'll be able to get those questions to our presenters. I just wanted to let everybody know that the presentation today is being recorded. Welcome, Modesta. Welcome, Sally. Thank you all for being here today to talk about culturally responsive community change strategies. It's glad to see all your faces here today. We are going to also have a survey at the end. And so I like to ask everyone to kind of stick around and just take a couple moments to fill that out. And I'll share that with you again at the end of our presentation today. The fun thing is we also have some emoticons here on the bottom of your screen. If you look, there's a little thing that says reactions with a smile face. You can click that. Please feel free to use those reactions because our cameras are off today. Everyone is muted today, but we still want to hear from you. So please feel free to do that. And we have Jenny here from CVent supporting us. She put a message in the chat box to kind of bring that up to your attention to say, here's the chat box. So everyone can see that there. Please feel free to say hello. Why don't we go ahead and go to next slide. Before we get started today, I just wanted to let everybody know that this training is offered through the Crisis and Recovery Enhancement TA Center, which is funded by the California Department of Healthcare Services and administered by the Center of Applied Research Solutions. In this training, the views, opinions, and content expressed in the presentation, they do not necessarily reflect the views, opinions, or policies of the California Department of Health Care Services. And if there is any case of any type of security issues, also, if we can go to the next slide. If there's any type of security issues, I just want you guys to know that we're going to immediately close this session down and a separate email will be sent out to you right away with further instructions on how to rejoin us. Next slide. So I see we have our wonderful presenters here on the slide. Before we introduce them, I wanted to kind of talk to you a little bit more. There's going to be, just some community agreements I wanted to share with you. This is just be kind to share the space. Have the right to change your mind. If there's any concerns that you guys have while you're here, or please feel free to reach out to myself or to our CVent tech. We just want to make sure everyone feels comfortable and they're in a safe place. Please feel free to reach out to any support that you need. We also have a group that you can reach out to called CalmSpace. It is in our exhibitor booth. So at any time you feel that you might just need to take a little break for yourself and walk away, but you want to stay within the conference, please feel free to log out of the session, go into the exhibitor booth in CalmSpace and take a moment for yourself. If you have any tech issues, please feel free to send a message into the chat and our CVent tech will be happy to help as well. I would, with my pleasure, I would like to hand over the floor to Ileana Soto-Welty and to Dr. Miguel Gallardo, pardon me for pronouncing that incorrectly.
All good, Tori.
We're just honored to have them here with us today, and I'd like to give them the opportunity to introduce themselves.
Sure, thank you for having us. We are with MECA, the Multi-Ethnic Collaborative of Community Agencies located in Orange County. And I'm the executive director. And we also have Dr. Miguel Gallardo, who is our research and evaluation director. He's also professor of psychology at Pepperdine University.
Yeah, hi everyone. Good to be here and look forward to spending a little bit of time with everyone today. Thank you. All right, you ready for the next slide, Nana?
Yes.
Okay, all right.
So today we wanted to share a little bit about our programs at MECA around behavioral health, suicide prevention, substance use, stigma reduction, and other initiatives that we are doing. And also what we have learned over the years in working with multicultural communities and the cultural considerations that when working with them. And lastly, we wanted to share different strategies to advance equity in the behavioral health system and ensure cultural responsiveness that is inclusive of different voices. So just a little bit about MECA. We're a collective impact coalition, and MECA has been around for over 10 years. These are the different organizations that we work with. Our mission is to eliminate racial and ethnic disparities and lead health equity efforts by working with our service providers and other partners to ensure that we are improving the quality of life for underserved communities. We serve the threshold languages in Orange County, which include Arabic, Farsi, Korean, Spanish, Vietnamese, and Chinese, as well as some other languages, including Khmer. And we also work with the LGBTQ organization called VROC. Together, our partners, we collaborate with each other. Our goal is to create an integrative system of care for multicultural communities that is culturally and linguistically responsive. But MECA leads the coalition, and the organizations provide the direct services, and we provide the advocacy that is needed to advance this work, as well as the resources, the research, and being the backbone organization for this collaborative. And our educational partner is Pepperdine University. Next slide. Here are some of the services that we provide, and I'll go over them real quickly, but we've been doing a lot of stigma reduction work through our Drawing Out Stigma program, our early intervention services for older adults. We have some parent support programs, substance use prevention and intervention, children's mental health access. We also are doing ACEs aware work. We have a multicultural suicide prevention initiative, and we are also doing a Hope for Orange County crisis counseling program. The work that we have been doing as a collaborative has never really been done before, because we are able to create a lot of impact by being able to provide these services in multiple languages for all of the different communities who are trusted messengers who have been doing this work and working with communities for many years. And so by leveraging their strengths, we are able to serve communities in new ways. So I'm just going to highlight a little bit about our programs. These pictures are from our Multicultural Arts Festival that we didn't do last year, and hopefully we can do next year, that we have held at Bowers Museum and other museums over the past 10 years. Next slide. So we've been doing this program the longest. We work with older adults who are isolated and who are at risk of mental health conditions. This program is funded by the county's MHSA dollars. And what I like about this program is that it's delivered in 7 different communities and different languages. And so each of the socialization activities, the classes, they all look different based on that community. So they all, you know, not everybody celebrates Halloween and Christmas. And so each of the organizations tailor all of the work to those specific communities and in their language. And in the past year, I think it's been really an honor to be able to serve these these older adults by providing, you know, supplies, resources in terms of money, food. We did more home visits in the first 3 months than we had done in a year because of the tremendous need to keep our elders safe. And so this is a great program that, you know, we were able to do this past year. Next slide. Our Drawing Out Stigma program, we've also been doing it for about 10 years. In the chat, I will put some of the links for our website as well as our social media handles. But one of the things that we did that was very, can everybody see that? Is we've used the arts as a way to have people open up about mental health. Not everybody feels comfortable doing the one-to-one therapy, or, you know, there's a lot of resistance to that. So coming in with a group and doing art, sometimes we've done drumming, dancing, just different types of art has really helped people open up and start the conversations around mental health. We were able to document our process through a film that we did a couple years ago called My Story, My Journey. It's on YouTube. It was also part of a local film festival, and you can see the link in the chat along with many of the other videos that we've created at MECA. If you go to our website, ocmeca.org, you can see the stories that we've collected this past year. We've used different art forms over the years, and last year we used writing. So we collected stories about mental health, stories of hope, stories of recovery around substance use. And these are all from our ethnic communities, and they felt comfortable opening up. It's done anonymously. We also put together a book called These Are Our Stories. And I've included a link to a Google Drive where you can download the book, which has mental health stories from all of our different organizations. So using these multimedia strategies has been really helpful to get people to open up. We showcase the work. This past year, we did it through many Zoom presentations and connections, and people felt like that it was actually really impactful to come together and connect. And people, you know, in these webinars heard stories, and then they shared their own stories. And then when they come together at our arts festival, we have, you know, several thousand people there looking at the different art that people have created as well. So it's just a really great celebration of to talk about mental health openly in the community. Next slide. One of the things that we had never done before was substance use disorder. And our organization said, you know, we don't talk about this. And so we started these conversations. We developed a lot of materials in different languages. We did videos. We connected people to services. We developed a social media campaign. In the Google link, you'll see some of the assets that we created. But in the trainings for both teens and parents and adults that we did out in the community. And one of the things that I heard was people had never had the opportunity to talk about this. But when it's done from an organization that is trusted, they were able to open up. They were able to say, yeah, I need support. I want to be connected to services. And many of these sessions ran over because people, you know, for the first time had an opportunity to talk about, you know, a family member or themselves, or a friend that has been challenged with substance use disorder. So we called this campaign Destigmatizing Recovery, and we did it in the multiple languages. And we're continuing to do this work and expand on our resources. In the link also, you'll see a video series with Dr. Mario, who is an expert in addiction and substance use. And it's meant for any organization. The videos are about 3 minutes each. There's 10 of them in the PDF file, and you can click on the link and it'll take you to our YouTube page. And I recommend people, show one a day or one a week over a series of time. And he does it in such a compassionate way, talking about substance use, that, we want to normalize these conversations. We want organizations and institutions to begin talking about this and learning about substance use. So that's a great resource to have. Next. One of the other things that we also did is we created a multicultural suicide prevention initiative where we did research with our organizations, focus groups, one-to-one interviews, surveys, and we did an inventory of, what kind of suicide prevention tools have organizations done in the past? And we realized there's a lot of gaps in services. And the current curriculums that are out there didn't really resonate with our community members, and there was a lot of silence. So we began developing materials and collecting stories. We did a social media campaign, and we put this out there during the pandemic and to help people come together. The training that we developed is called Strengthening Our Ties. And based on all the research that we did, we put together, I believe, 9 different trainings in different languages for youth, for providers, for older adults, to begin to open up about what are the signs and symptoms of suicide, and do it in a culturally responsive way through the community mental health workers that we have at each of the agencies. We wanted this to be sort of a peer-to-peer way for communities to connect with each other. And again, this was another transformational process where people, many times for the first time were opening up about this and how they can be a support for others. There's in the Google Drive, there's also that presentation that we did last week at the CIBHS Equity Conference, if you are interested in looking at more closely at some of our learnings from that process. Next. And then we just have different initiatives. We have developed curriculum on early childhood mental health, teen mental health workshops, and that incorporates ACEs into the curriculum. We've developed a lot of PSAs that are also on our YouTube page, and feel free to use those. We have developed a lot of resources that are on our website that you can use. One of the big programs that we're doing right now in terms of recovery from COVID is we're doing a CalMesa funded program called Hope for Orange County. That's what we're calling it. And we're delivering it in 15 languages. And we have over 12 organizations that are part of that initiative. And everything that we do, we are working in collaboration with our organizations to ensure that that everything and the trainings, the support groups, everything really connects with communities. And next slide. So I'm going to turn it over to Miguel. That was just a quick overview of the things that we do. These are just the mental health programs that we do at MECA, but we also have been doing a lot of work around public health and equity and advocacy and policy to advance health equity overall. But Miguel, you've been with MECA for over 10 years doing our evaluation, and you're one of the founders of MECA. So I'm sure you've learned a lot, and you can share with us.
Yeah, sure. Thank you, Ileana. Ileana says I talk a lot, so I'm going to try to be quick because we don't have a whole lot of time today. And so there's a lot to say, though. I'm sort of joking, but also because there's just so much to say about our work. I would say that just as you think about all the programs that Ileana just reviewed, and the ones that we've been working on for many years now, and the ones that we're implementing and developing more recently. I would say that there are four really guiding principles or ideologies that really serve as the backdrop for all of our work. And so I would say that, you know, from the beginning of our work, which was over a decade ago, there was always this notion that you know, we always try to fit people into spaces maybe where they don't fit. And you know this one size fits all, this universality concept, and when people don't fit into those spaces that, you know, really are designed and developed for only certain groups of people or communities or whatnot, we start to chip away at those people and those communities that don't fit into those spaces, those systems, until we mold them to sort of really fit into what already exists. And I think that that's probably one of the greatest travesties we can do when trying to really address the needs of underserved and unserved communities, because we really start to chip away at their identities, their worldviews, their already existing strengths and resources that we can really build from. And so when they don't fit into our systems and into the already existing programs or formats that we have, we really start to put the blame on them for not fitting. And I think we need to reframe that. And so I think coming together as we developed our MECA programs, it was around really trying to really validate and make sure that people heard the voices of all the community members who didn't like to be shaped and molded and to be fit into spaces where they didn't feel comfortable and didn't belong. And so every culture has different ways of understanding, you know, how they view what they're experiencing, the cause of it, you know, how it affects them, and then what they deem to be really culturally resonant ways of healing from those kinds of things. And so we ask the question, what are the challenges? Not what's wrong with you, but what are the challenges you're facing, and what kinds of and what ways do you heal? What ways do you believe are legitimate ways of healing? And then I would say, you know, even more recently, we've been a lot more intentional around our work around an anti-racism intersectional framework. Audre Lorde said that there's no such thing as a single issue struggle because we don't live single issue lives. And so our anti-racism intersectional framework, I think, really also drives our model even more so with such level of intentionality, because our communities are incredibly diverse, and they're not, you know, all the same. And you know, we don't talk about one of our agencies as looking exactly the same. There's so much diversity and variety within those agencies and then within our communities that we have to be thinking about an anti-racist intersectional approach, which is really about understanding the multiply oppressed statuses that people exist in when trying to negotiate the systems that were not designed for us, essentially. We are trying to negotiate systems that were not designed for us as BIPOC. And so an anti-racism perspective is about changing. It's action-oriented and change. And that's what we do at MECA. And that's what our goals are in many ways. And then we don't do anything without the community's perspectives. I mean, we walk with community members. We don't tell them what to do. We don't assume that we have all the answers. We walk together. We learn from each other. We use a community-based participatory action research framework and model. And that really has, I think, served us well. So all these programs that Ileana just went over have been designed with the community's input in mind and with their feedback, because we cannot implement these programs if we just perpetuate unintentionally oppressive practices when trying to liberate communities. And we want to make sure we don't do that. So I think in general, what we have found is that there's just a lack of information available in various languages. And we know this, and many of you listening know this, that there aren't even words for some of our programs that exist in some communities. And so it's not just about a literal linguistic translation at times, because we know that isn't always effective, but it's a linguistic, contextual, cultural translation in our work that is so evident and so critical to really making it accessible and really giving folks accurate information. Accessible, accurate information has been one of our primary goals, and one of the things that we've been able to do with the help of our agencies. And then across all our programs, and this is not going to be news to you, but stigma is still alive and well, and we're still moving through reframing, re-envisioning, and revisiting the stigmas that are attached to suicidality, substance use, mental health challenges, whatever it may be. And then what we know is that if you build it, they will come. As a baseball fan, for those of you who are baseball fans, you know what I'm referring to. So the field of dreams, if you build it, they will come. We have found that while many of our agencies and community members have not initially wanted to talk about a lot of these topical areas and programs that we've implemented, with the help of our community members and the agency staff, we have made programs that are culturally responsive and resonant with our communities. And as a result of that, people have showed up and have asked for more as a result of that. And so there's something about these partnerships that are very meaningful and powerful. It has to be culturally meaningful for folks. It has to resonate with them. We have to understand, and I always say, we need to start with what's right with people before we start with what's wrong with them. And I think that's really been part of our push as well. Like, what's right with our communities? What can we build from to do something better? And it's not just around even just culturally adaptation, but culturally indigenizing these programs, from the ground up, developing models and frameworks that are from the community, not just a top down adapting something that came from outside the community, but it's a both and. It's also, we do some of that, but we also infuse and embed culturally centered and grounded information frameworks and models that we can use to help our community members. And then where the information is coming from matters. So our agencies are a huge source of support for us because they're trusted, embedded in the community, and so it's through our agencies that we have been able to build these successful relationships. And so I think we have been able to the feedback has been folks want to create more spaces where not only safe but brave and courageous conversations can occur around all the program areas that Ileana mentioned. Once community members knew that it could be translated in all these different ways and all these different formats, culturally, linguistically, contextually, et cetera, they were hungry for that information. It resonated with them in many ways. And then really, how do we do a better job of preventing these things from happening, and really building awareness around that? So not just addressing it when something's already happened, which oftentimes happen, but doing work ahead of time so that we prevent these kinds of situations from occurring as much as we can. And then we also got a lot of feedback around that we've actually been able to decrease a lot of misperceptions and myths around a lot of these topical areas, which we have found to be really helpful. And then I already mentioned the last one, just, the strengths-based approach is really important. So I don't want to repeat that. Strengths over symptoms. I think it's important that we think about maybe it's our systems that are not well and not our people. So strength-based approach is critical for us. Resilience is something that is developed in our communities, and it continues to develop in our communities. This pandemic that we're hopefully moving out of was a good testament and testimonial to the strength inherent in many of our communities and the resiliency in many ways. We must adapt and both top-down interventions and implement culturally grounded and embedded interventions and programs in our communities. And then addressing logistical barriers, making it accessible. If we try to implement, programs in the community that are, just like anything else, it's not going to be successful no matter where it's coming from. We want to look at the protective factors. We should be doing those things because those are the things that we can build from. Money is important. Finance matters, but flexibility matters even more. So you can give us all the money, but if we can't implement it in the way that is going to be meaningful and accessible to create a positive impact in our communities, then all the money in the world is only going to help so much. And then we have to address implicit bias, those unconscious biases. When the majority of human behavior is automatic and involuntary, we need to recognize that, because I think there's a lot of good, well-intentioned providers and systems who might be unintentionally violating the communities they're attempting to serve. And then we need to continue to address the stigma and discrimination. All right, Ileana, I'm going to turn this back over to you.
Sure. We want to make sure that we allow enough time for discussion and interaction. So if you have any questions, please put them in the chat, and we can make this sort of the beginnings of that interaction right now. I wanted to share some of our just change strategies and our philosophy. I love this quote by Ayanna Pressley: those closest to the pain should be closest to the power. And this is what we aim to do in all of our work, and to be a collective voice for ethnic communities as we advocate for them in the systems that we are navigating. Next slide. So I'm just going to touch on some of these things as I go, but the model that we used is community-based participatory research, and we try to integrate that into the work that we do as much as possible. And also, as we do the work, we're always asking folks what's working, what's not working, and we take that back to the funder, and we create some flexibilities as we move forward, so that we ensure that the programs are connecting with communities in a meaningful way. Doing this work, I just want to sort of contextualize Orange County a little bit. It's a very polarizing place, but it's also a very diverse place. We have over 60% of the community are ethnic communities, but the systems haven't really kept up. So as we are advocating for communities, we also realize the institutions and the policies and all these things, we need to create a driving force to help change those. And, you know, and it's hard because our history, you know, there's a history of anti-immigrant policies that come out of Orange County. A lot of people that are conservative, and, you know, it's juxtaposed in the sense that we have the happiest place on earth in Orange County, but we also, right next to it, have an HBO special focused on the motel kids that are right next to Disneyland. So it's just a dynamic place. And within that, you know, we've learned to be resilient. I've been doing diversity work since I was in college. And I think that one of the things that I realized at one point is that it's okay to create individual change, but it's more meaningful and impactful to create organizational and institutional change. And so my passion is being an organizer and a community builder. And I hope to help people have a voice in the systems and institutions that impact their lives. And to me, that's what anti-racism work is. It's about identifying and challenging racism by changing systems and organizational structures and policies and practices to make sure that there's more equity in our society. And so this is not a checklist. It's a process, it's a purpose, and it takes a lot of persistence, and it requires a long-term commitment. I think many times people want this to be easy, but it's really hard. It gets really uncomfortable at times. And sometimes you have to go sort of through a process of resistance, but then there's reconciliation. And that's the change process overall. Our work is about moving beyond cultural competency and cultural appropriateness to being culturally responsive and affirming. You know, I think that this is like an onion. We have to, you know, remove the layers and the barriers and get to a place where all of us can be our authentic selves and, you know, be able to do this work in a meaningful way. I loved what you said, Miguel, about what healing means to our communities. It means a lot of things. And many times when we come to this country, healing looks a certain way, you know, but in our cultures, healing is much broader than that. And so we want to continue to expand our thinking around that. And, you know, we're just a really innovative group. And sometimes when we bring these new topics or ideas to our organizations, we first have to convince the leadership. And then sometimes it takes one leader to sort of convince the others too. And but they all sort of eventually rise to the occasion and we figure it out. We were one of the first ones to teach religious leaders about mental health through a MHSA Innovations program. And believe me, it was very challenging. Lots of doors were closed. A lot of religious philosophy was thrown at our staff initially, but then because there were, you know, some religious leaders that spoke out in each community, and it just kind of, you know, opened up those doors eventually. So there's just a lot of different strategies that we need to employ to do this work. But it does take people sharing their stories, people being brave to sort of pave that way. I wanted to share the story of one of the programs that we are supporting called Peer Voices of Orange County. And this, people with lived experience were invited to come to a stigma reduction group that I was leading. And afterwards, we had another meeting after the meeting. And they talked about how they didn't feel heard, they didn't feel valued, they didn't feel incorporated into the system. And many times we try to do community engagement by doing surveys or this forum or that. But, you know, what about developing a consumer-led movement where they are sharing on an ongoing basis what are some of the policies that need to change? And so they're in the process of doing that, and they're part of a behavioral health system transformation movement led by Be Well. And so together, Be Well and Mecca are supporting this group that came out of sort of a loose network of peers coming together. And so now they're on an organization, they have their own office, they're developing their own resources to get their voices out about how we need to change the system. We are really lucky to be able to work with the California Youth Empowerment Network, which is completely youth-led. And they just did a conference this month and then a workshop last month. And so we are always trying to figure out ways to incorporate youth, you know, TikTok videos. It's not always enough to do focus groups, but we're aiming to do more stuff that is peer-led, youth-led as we move forward, because that'll be able to connect more with them. And then we are also leading the equity and inclusion group for the ACEs Trauma Informed Network of Care, where we're centering equity. And one of the challenges with doing this work is that we're always, you know, seen as, oh, you know, if we're involved with Mecca, then we've got the whole inclusion thing addressed, and it's a checkbox, or it's Mecca's work to do this. But really what we're trying to do is that this is our work, and we have to change the way we see the way that we do this work in the community in order for people to really be improved by the services that we offer. So we're developing an intersectional equity framework that's going to have a trauma-informed frame, an anti-racism frame, and other frames, so that it'll be a measure by which we can, you know, do the work in a meaningful way. I also wanted to talk about we are involved in a lot of different policy and systems change initiatives locally, regionally, and statewide. And we try to push at different levels, inside strategies, outside strategies, leading committees, being involved in different collaboratives. We can't be everywhere all the time, but because we have a network, our executive directors or our staff or our allies are involved in different initiatives. And when we come together and we try to advance this work together. So it's like an army of folks. It sort of takes that to move some of these things forward. And, you know, one of my beliefs is that if it doesn't exist, you have to create it. And so sometimes the system doesn't set up a meaningful way to participate in strategic planning, for example. Or so we have just held our own forums. Next slide. This is an example of a forum that we did, and we developed a mental health equity framework based on the conversations that we had with providers, with consumers, and our ethnic communities, and recommendations that we set forth and we continue to advance in the work that we do in the spaces that we are in. And I'll just read 3 of the quotes that we put on here. Services should be able to accommodate to all populations, not populations to services. Many times we think just because, you know, there's a funded project out there, people don't know about it, you know, and we expect people to go to that program, but what are we doing to make that more accessible to folks? And then understand the culture, religion, and spirituality of the community is really, I think, important in looking at the whole person approach. Although we are a small group, the needs are big. And so really looking at equity and providing extra supports for our communities so that they can have access to services and be able to have more wellness in their community. These are some of our partners that we work with, and I just kind of want to leave space for us to have conversations. I could go on and on about how we work to change paradigms, but I think anytime I'm presented with, I'm in a group of leaders, many times, you know, we need to expand the circle more instead of making it smaller. And one time I remember somebody told me, well, we've got all the right people here. We just make the decisions and I had to interrupt that. We have to interrupt these things and say, no, I come here representing our ethnic communities. And if we make the decisions without knowing what really works for them, then we're not creating meaningful change. And so sometimes we have to slow down in order to go faster as a community. I think this work is hard, but it's very possible, and we have to reimagine the way that we work with systems. It's about building a partnership. Sometimes we see the systems as adversarial, which it can be, but we need to see it more as we're working together because we ultimately both have the same goals. We want to make sure that programs are accessible to communities and that we are addressing equity issues. So I think we just need to think differently about this, and sometimes there's resistance because, oh, we've never done it that way. Well, it's time now to do it differently. That's it. Anybody have any questions? This is our collective impact model, but I feel like we've kind of moved beyond this model. We are not just a facilitator, but of one program, but multiple programs that are using this collective impact approach, with Miguel doing the research parts of it. You know, we come together and learn together. There's continuous communication, and we provide that backbone support, but it's an iterative process and we're continuously learning. And so we're persistent and committed to this for the long haul. And we're hoping that some of our strategies and ideas can spark innovation in other communities throughout the state.
So since we are at our question and discussion time, I just wanted to ask if somebody in the audience could please use the reactions at the bottom of the page and thumbs up if the chat box is working for them. I'm not seeing any questions come in, but I haven't seen any comments or just hello either. And a lot of times we'll just get some hellos or, you know, introductions. I do see a thumbs up. Thank you so much, Jess. I appreciate it. I just want to make sure it's working for everyone. Please feel free to put whatever questions or comments that you guys may have in the chat box. As of right now, we don't have any comments or questions coming in yet.
I did want to take this moment to reshare. I don't know if everybody can see our website, ocmecca.org, where you can get more resources that I mentioned. The Google link that has our assets and the presentation for today, as well as other resources. And Miguel's website, drgallardo.com, he has a Cultural Humility podcast that is really awesome. And he's got some great speakers. It's very relevant to the issues that communities of color are facing today. And I don't know if you want to say more about that, Miguel.
No, thank you, Leanne. I appreciate it. No, I just, yeah, it's just an opportunity to try to understand important issues more. The last two interviews I did were on pregnancy loss in LGBTQ plus communities, and the religion of Americanism versus the religion of Christianity, as a couple of more recent topics. But there's a lot of different topical areas on there. I mean, I'm assuming if you're interested in attending this conference on anti-racism, there'll probably be a lot of really relevant topics for you. I always say I need to take Ileana with me wherever I go, because she's good about promoting folks and bringing folks up. So I appreciate that. Thank you.
That's what we do. We lift up different voices.
Yeah.
So it looks like we do have one question. And that is, how do you connect with City Council?
So we, it's all about building relationships. At the city level, we're not as involved at the city level. Our cities are, we're involved more at the county level and at maybe regional and state level. But like I said, we can't be everywhere every time, but our organizations definitely have really strong relationships with the cities. And many times the cities have CDBG funds, for example. We do not apply for those as MECA. We apply for much larger grants that we can sort of share with the other organizations. So smaller grants we leave for the organizations to apply for. That's usually through the cities. And then, collectively, if we need to support each other on city level issues, MECA will come in and step in and advocate or present at a city council meeting. But, we really leverage the organizations that we work with, who are all over the county and are embedded in the communities that they serve. So we both have different roles at different times.
Thank you, Ileana, for your response. Thank you, Jess, for your question.
I got a direct question, actually. What are tools and resources for working with immigrant, Latinx, and API youth from a culturally healing framework to prevent substance use risk? That's a really great question. We are part of a larger substance use network through Be Well, which is a mental health, another collective impact organization, but for mental health in Orange County, and they have an SED leadership committee, and we were partnered with them for a youth opioid response project, and we work through our agencies to reach the different populations. And we're still learning. We have a second grant for the youth opioid response. And one of the things that we learned is that we haven't done enough work with youth. And so that's going to be the major focus of this initiative moving forward. And we're doing a focus group with them next week. And we're going to incorporate our TAE group that we have to help us design and redesign our curriculum because what we learned is that, you know, it needs to have more of that youth component, youth voice, and we hired some great staff to help us do that. So I think this is like a process where we're continuing to learn, and we have to realize, you know, what's working for them. Everything that we do, we're incorporating the youth voice in it, but you know, we're going to be doing stuff on stimulant use, and that's something that we've never done before. But going to the youth and seeing like what's actually going on in your communities, in your schools, what are the stressors? Sometimes it's because, you know, a child didn't do well in school, so I think it affects all communities, those that are successful, that are perceived as being successful, and those that are, you know, maybe not doing as well. And so I think I'll pass it over to you, Miguel. But
yeah, so
we need to work on.
What's that?
Go ahead.
You know, what I would say is that you know, when you ask that question, or whoever asked the question, this Mexican proverb came to mind, and it says they thought they could bury us, but they didn't realize that we were seeds, or didn't know that we were seeds, and so no matter what, we keep flourishing. And why I say that is because I think one of the things that we know about you know, protective factors and sort of developing sense of resilience along the way is that when we're connected to our root systems, you know, to who we are ethnically, to who we are culturally in many ways, we know that we're less likely to do harm to ourselves. And I think there's such a, particularly for youth and young persons today of who are BIPOC, whether they're Latinx, Asian, or Black, or whoever it may be, I think there's something around helping us retain our cultural values and historical ancestral roots in many ways. And so I think, you know, if we go back to what I said earlier around trying to fit people into spaces that they don't belong, I think that's what happens here all the time, is that we're trying to get people to adjust to systems that aren't made for them and aren't made for us in some ways. And so how do we continue to negotiate those processes while not losing one's sense of self from a cultural perspective, from a racial, ethnic perspective? And there was a great Brown paper that was written probably a decade or so at this point ago by the National Fatherhood, and I'm not forgetting the full name of this organization, but it was on connecting young Latino boys to their root straps, not necessarily worrying about bootstraps, but root straps. And there's a lot of research that talks about that. So I think there's something there about you know, thinking about decolonizing, deconstructing, and revisiting and reconnecting with the things that we've lost along the way, and that the systems that we exist in continue to try to tease out and sort of tear away from us slowly, very slowly. Sometimes it's very loudly and very painfully, but most of the time it's very subtle, in a very subtle, indiscreet, sort of, you know, discreet and really painful way most of the time. So I think those things are really important as well to think about.
I also wanted to add, since you mentioned Brown paper, we do have a report that Dr. Gallardo, we write reports for everything, but the public reports that we'll have around multicultural suicide and SUD prevention and our learnings, we'll have later on this summer. And we're also developing a Brown paper based on our conversations on the racial and ethnic implications of ACEs screening and our recommendations for that. So we will also have a paper on what's working around SUD for youth. One of our organizations has a really sort of deeper involvement with the API community and the Latinx community. And so, you know, lifting up those types of strategies that they're learning as well will be part of that. And then another question is, does MECA partner with CBOs on smaller projects? Yes, small projects, larger projects. I mentioned our member organizations, but we have lots of other partners that are included sort of in our extended network, and we're always hoping to build capacity for the different organizations. Some of our organizations, you know, that we work with, that sort of we want to build them up because we realize that their work is very needed, especially, for example, our LGBTQ community who's working with youth that are from communities of color. And so supporting them in their research and their work is really important to us. For me, I find that the smaller organizations have a wider reach than the larger organizations. They have like more Facebook followers, their videos go viral, their voices are just so energetic. So yeah, we definitely support them.
Right. Yeah, and I want to turn this over to Tori because I know she needs some time to wrap up. So Tori, I'm going to turn this back over to you. This is information where you can follow up with us, contact us, follow us, and so you have that hopefully. You also have a copy of the presentation. So, Tori, is this you? You're on mute. You're on mute, Tori. Yeah.
That's not helpful. Thank you so much, Miguel. Thank you, Ileana, for your amazing work and for allowing us to just join you guys today and to learn so much more and being a part of it. I want to thank all of you guys here for attending. Jenny went ahead and put in a link right there in the chat box that is for our feedback form. Please take a few minutes to give us your feedback. We do use it to plan future events and provide future resources to you. So we really, truly appreciate all the feedback that you have. Can we go to the next screen? We do look forward to working with all of you guys in the future. Please stay in touch. This is the email here for the care team and the website, Facebook. So I'm going to go ahead and leave this screen up here for you guys just for a couple minutes. The survey is in the chat. Again, if you have any last minute comments, you're welcome to throw them in the chat. And we're just so grateful to have all of you guys here at conference today. Jenny, also, thank you so much for your support today on the back end. We appreciate you. So please feel free when you're done with your feedback form, please feel free to join us in our next session. We'll be happy to see you there.
Thank you
again,
Miguel. Thank you, Tori. Thank you to CARE.
Thanks, Tori. Thanks, Jenny. Appreciate it. Thank you.